Hi everyone, welcome to today's live chat with Dr. Chopra on COVID-19. We will be having Dr. Chopra join shortly and we will get started with our questions as soon as he does. Looks like he is on board for it too, so we will patch him in right now.
Hey, Ed.
Hi, Dr. Chopra, how are you?
Very well. How are you?
I'm excellent. Thank you so much for joining us.
Thank you for having me. It's a pleasure. Excuse my hair. I took my mask off a second ago, so it's been one of those days.
At least you have that excuse. I have no such excuse. So, well, thank you for starters for joining us. Thank you to everybody else who is here for our COVID-19 Instagram Live Q&A. Before we get started with the questions, though, if you could just introduce yourself, tell this audience a little bit about yourself.
Yeah, my name is Vineet Chopra. I am a hospitalist, so an acute care internal medicine doctor at the University of Michigan. I've been here since 2007, and I am currently the chief of the division, which is a large group of doctors. We're about 130 physicians, about 30 advanced practice providers, and I oversee all of the acute care in the hospital on the general medicine services.
Fantastic. Well, it's great to have you on board. My first question for you, I'm not going to beat about the bush. Let's jump straight in with our questions. At Michigan Medicine, we're pretty open about our numbers. Every day on our website, also on social media, we post the numbers of everything from patients tested at Michigan Medicine, total positive tests, our current inpatients that are COVID-19 positive, all the patients that we've discharged to date. My question for you, Dr. Chopra, in your opinion, where do you think we are in this pandemic based on those numbers?
Yeah, it's a good question. So you know what they say about predictions, right? Some of them are useful, others were just hopeful thinking. I think what we have seen and what I'm confident of is we've seen our peak of cases. And I base that on the fact that our numbers that are coming into our health system of patients who are acutely sick or patients who need our care seem to be plateauing off. There's been a little bit of even a steady decline over the last 2 or 3 days of the numbers of acute cases we've seen. That being said, I don't think we're out of the woods quite yet. There's a large number of patients who are still in the hospital, still quite sick. Many of them are in the intensive care units. Some of them are still on the wards recovering from this. And so I anticipate that we're going to be dealing with this for the next month or 2 or 3. I do think, though, the number of new cases that we're seeing, in part because of all of the social distancing, all the things everyone who's watching is doing at home, not going out and not getting too close in terms of preventing viral transmission, I think all of that has been working very well. And so we're seeing fewer cases as a result. So very grateful to the community and to the public for doing their part in helping us fight this disease.
Definitely. And, you know, you touched on this a little bit, but one of the questions that just came in is how do you think we can prevent a second peak?
Yeah, it's the million-dollar question. And I certainly think there are things we can do to prevent that second peak. So first and foremost, this virus spreads through respiratory droplets and through aerosolization. And so people who are coughing, who are sneezing, there's even some talk now about people who are actively panting or breathing heavily can transmit the virus. So keeping a distance from individuals, much as, you know, we are social creatures, that's not who we are, but really keeping that space is very, very important. So I think social distancing is going to be key. That also means things like large gatherings, right? So things like football season at Michigan, or for example, large concerts in the summer, art fair, the things that make Ann Arbor very special. I think those are things we're going to have to reconsider this year. Because when we get that many people together that close, it really is going to have an impact. The third and most important thing I want to highlight that people don't remember as much are these guys, our hands. So this infection spreads because people cover their cough and they have particles on their hands and then they touch something or someone. And so keeping our hands clean, using hand hygiene and dispensers to really make sure that we don't spread the bugs. Those are 3 things that I think we're going to have to do to prevent a second peak.
Thank you so much for that. This kind of leads in a little bit. We've talked about some of the symptoms of COVID-19.
Yep.
Do you know if there are any new symptoms we should be aware of?
It's a great question. So the commonest ones are fever, cough, and shortness of breath. If you look at the data from the US and a number of other centers, fever hits about 60 to 70% of people. Cough is close, it's up there. It's about 50 to 60% of people. And the shortness of breath, when you start to feel like you're getting really dyspneic or having difficulty breathing, that's lower in the list of frequency. About 35 to 40% of people will develop those symptoms. What's been new and what's interesting is this symptom of loss of smell and loss of taste. And we really don't know why that happens. The numbers currently suggest anywhere from 10 to 15% of people will experience this. There are some theories. Some people think it may be because the virus actually attacks the receptors for smell and taste. Other theories are all about the inflammation that this creates, and that can actually cause you to feel unwell and alter those primal senses. In about 10% of patients, we see diarrhea, so gastrointestinal symptoms. Coronavirus loves mucus. It loves the membranes, and the entire gut is a very large membrane. And so you can see diarrhea happen in some of these cases as well. And then one common symptom that's not had much attention is in the eyes. So conjunctivitis. And you think about all the viruses out there and how they present, the eye irritation, the redness, the mucus, and the discharge. We are seeing some reports now of conjunctivitis in as many as 30% of patients who present with coronavirus. So those are some newer symptoms that we're getting a better sense of now in some of the studies that are coming out from Seattle, from New York, and a number of other states that are afflicted with this disease.
Thank you. Thank you so much for that. You know, we have lots and lots of questions coming in, so I'm trying to cherry pick.
Sure.
This is one that we've seen a lot of, if I can pull it up. Homemade mask versus a medical mask.
Yeah, great question. So I think one of the reasons that I brought up the whole issue of social distancing is keeping away from people to prevent transmission is really important. A better way, and the one that the CDC now recommends for us in the nation, is to cover our mouths with a mask. Homemade masks made out of cloth or other materials do just as well in covering up your mouth. And my recommendation, and this is in line with what the government recommends, is really use whatever you can use that is homemade or you can get from a cloth mask perspective for yourself. Leave the medical masks to the medical providers. We are really in Michigan lucky because we've made some very good plans and have a very thoughtful approach to our use of masks in the hospital. But again, these supplies are limited right now. Everyone in the country is looking for these supplies. And so leave the medical masks for the medical providers.
Thank you, Dr. Chopra. I think that's a really important point there. This is another question that we've seen quite a lot of. If I suspect I have a mild case of COVID-19, how can I treat myself at home?
Yeah, it's a great question. So the symptoms are very nonspecific, as I just mentioned. So the fever occurs with many viral infections. I think if you have a fever and you have a cough or you're short of breath, the first thing you should do is think about isolating yourself. And that would basically mean being in a room or an environment or a footprint that you're going to call your own, especially if you live with other people, including folks who may have other medical conditions. This virus is very, very contagious, so you want to make sure that you're going to be in an environment that doesn't spread to others. The next thing I'd recommend is reach out to a medical provider. It's very difficult to diagnose this by yourself. You're going to need to get a test. And testing is, of course, not easy. It's challenging. We at Michigan Medicine, I think, have done a good job of increasing our testing capacity across the institution, but also through our clinics, through drive-through opportunities. You really should get tested and talk to your medical provider first to understand how you can get in to have that type of testing. And then if you are positive, there's some things you should do to protect yourself and others. So as I said, finding a footprint in the house that you're going to call your own. That should include a bathroom because there are some reports of virus shedding in stool. And so we want to make sure you have your own personal place for hygiene. Your clothes and other materials where you may sneeze or cough or breathe on could contain virus. We know that this virus can live on surfaces for a little while. So having a separate place for laundry, or to have an environment where you can actually do that by yourself is really important. And then again, keeping a distance from those around you. I will tell you, I've had this conversation with my loved ones since I've been on the front lines. And our plan is I will stay in a room in the basement. The kids will be able to see me outside the door with the door open, because I still need that contact and that connection with them. But again, far enough where we won't come into contact. I will be wearing a mask, a bandana or a cloth mask since I'm at home, to prevent transmission. And again, I will have my own bathroom and my own place to do my hygiene and to do my clothes and laundry. So that's what I would recommend if you end up with this virus. Heaven forbid you get that.
Yeah, you know, that's fantastic advice. It's good to hear what you might implement yourself were it to happen to you. So the other questions, I think you've touched on a couple of these. Here's a question we've seen a few times. Who is at higher risk for serious illness from COVID-19?
Yeah, it's a great question. So I'll tell you the traditional answer, then I'll tell you what we've been seeing here at Michigan Medicine. The traditional answer is that this virus likes older people. So by far and above, the people that get sick tend to be those over 65 years of age. People tend to have comorbid conditions that drives up their risk. And those big ones are diabetes, high blood pressure, and some type of existing lung disease. So COPD or asthma, because those make you more prone to developing lung infections. Those are the people that when they get this infection, not only do they get it and get worse quickly, they also have worse outcomes because they end up needing more mechanical ventilation, or they end up needing more support, more invasive support. But what we have seen here, and why I think it's important for the public to be really thoughtful about the engagements and about how they interact with others, is we've seen young people with no medical problems develop this disease. Not only develop it, but end up in the ICU with it. And I'll tell you, you know, as someone in the mid 40s, which is me, I have a bit of a, you know, a complex of this is not going to happen to me. And it could. And, you know, the 30-year-old who has no medical problems, who ends up in our ICU, that's a moment that actually gets us thinking a lot about what our true risk is. The other group I want to highlight that's also at risk, besides those typical conditions, are healthcare workers. So we've seen from data from the CDC that about 10 to 20% of people that have COVID-19 in the US are healthcare workers. And I, you know, as being one of those people, that really upsets me. But it's also why I think, you know, there's some of the strategies that we've taken at Michigan Medicine to ensure that healthcare workers have what they need to provide care. It just makes me feel good about working here. I do think that we've done all the right things to protect our front line.
That's really good to hear, and that's a really important answer you gave there, I think, especially for our audience. Moving on from who is at higher risk for serious illness from COVID-19, can we talk about this word that this phrase we hear a lot, community spread?
Yeah.
What is community spread?
That's a great question. So let me take you back to the beginning of COVID-19 when we heard about the epidemic and the pandemic in China. At that time, our government, in their wisdom, decided that we didn't want to import this virus, that we wanted to actually prevent international transfer. And so the initial strategy was prevent travel back and forth from areas that may have this infection. Now, some of that travel may already have happened, but the virus got here. And then we started to see people who travel domestically within the country start to have symptoms and spread virus amongst each other. The challenge with this virus is that, number one, it has a very long, quiet, or latent period where you may be completely asymptomatic, you may feel completely fine, and yet you may be infectious. So you may be spreading the virus when you don't know it. This concept of community transmission then reflects the fact that you may be out there doing your daily routine, out buying groceries, hanging out with your neighbor, playing basketball with your friends, and actually transmitting the virus. So when we began to look at the epidemic in the US, we focused initially on the international travelers. We then focused on the domestic travelers. And then we began to find people who had no history of travel, had no other risk factors, had not gone out of their city, for example, but were starting to have infections. And this is what community transmission means. It means somehow somebody got exposed, were asymptomatic, and then we're spreading the virus to others such that transmission in the community started to happen. And when you look at this virus in particular, because it has this long period where you don't know you actually have it, you potentially could infect a lot of people. So when we say community transmission, we mean spreading the virus within your community in an environment where you may not know that you're actually doing that.
Thank you for that. And moving on, we have two questions which kind of relate to each other. We've talked about social distancing, and people are asking, what can people do to help other than social distancing? And then we have this particular question right here: what is a good way to support medical workers without physically meeting with them? I know I see it on social a lot. People want to help.
Yeah.
How can they help?
Yeah, there's so many ways. So first and foremost, I would say, just for all of you listening and watching, thank you, because I think it's good to know that you're out there thinking about us and that you're concerned about us, and that's really important. There's a number of ways you can help us here at Michigan. We have a campaign called the Victor's Campaign that allows you to donate, whether it's food or supplies or equipment or money, other things that we can use for the frontline workers. At our last town hall, which we have every week here at Michigan Medicine, I told our entire health system on behalf of our dean that all of those proceeds, whatever came in through that, would be used for frontline workers. And so I think if you are wanting to give, and give in a way that includes any of the materials that I've described, or food or money, please reach out. You go to ufmhealth.org, look for our Victor's Fund or our Victor's Campaign. You will find a way there to support our healthcare workers. But I want to emphasize the most important thing you can do: stay home and do what we ask you to do, which is cover your mouth when you're out in public. That will help us, because it will help flatten that epidemic curve.
Thank you. Thank you so much for that. That was a lovely, detailed response. Let's move along. We don't have much time left. Can people go outside for walks, hikes, cycling, as long as they're maintaining the social distancing rules?
Yeah, first of all, I would say I do that. I'm fortunate to live in Ann Arbor, and I need to get out a little bit every day to maintain my mental sanity, given what I'm going through here. And so I would highly encourage you to do that. The key thing is, don't do it if you're not feeling well. So if you're starting to develop symptoms yourself, the worst thing you can do is get out there and start to expose others. And I would say keep your outdoor time to a minimum, and do it where you're not around a lot of people. So if you're an early morning riser and there's no one around you, and that's the best time for you, and you know that there's places where you're not going to get involved with other individuals, that's great. If you see a friend you know, please don't walk up to them and shake their hand. Keep your distance. And I know that's very hard. It's not who we are as individuals, but I think it's really important to do that. Stay across the street, wave hi, and you have that conversation amongst the masks. And yes, if you are much more involved in outdoor activities, biking, hiking, again, keep in those same precautions. Try to avoid large groups and try to do things by yourself with safe distancing as much as you can.
Thank you. I think that's the perfect answer there. We have time for a couple more questions, I think.
Okay.
My first one for you: will warm weather stop COVID-19?
It's a great question. I'll tell you, I hope so. But the science on this is still to be determined. So a lot of the seasonal viruses, you take influenza, for example, as a good example of corona, tend to have these peaks and troughs. And that's because the virus tends to get more fragile. It needs a certain type of temperature to thrive, cooler temperatures. The summer and the humidity makes the virus much more fragile, but also lowers the ability for it to transmit. And so we do see this sort of variation in viral illnesses. There's a lot of unknowns about this coronavirus. Number one, we haven't seen it before. So we don't know how it's going to behave in the winter/summer seasons. Number two, when you look at where the outbreak happened, countries like Iran, China, and now in Russia as well, Japan, South Korea, they tend to be in that northern latitude, but there are cases in the southern hemisphere, right? We see cases in Australia. We've seen cases also down in New Zealand. And so it's not as if temperature is a panacea. It's not a solution, but maybe there's a lowering of transmission in that context. The other aspect that comes into play in the summer is what happens with the perspective of immunity. So if we have a lot of people that are exposed now, one would hope that we would have some response, some immune response. Now we go out together in the summer and most of the people that we interact with tend to be immunized. We don't know that yet. Antibody testing or testing for immunity is still not online as much as we would like. And we don't even know if you have antibodies, whether that makes you immune to another infection. So there's a lot to be learned. There's a lot we don't know. I would say I'm with everyone. I'm hopeful that we can get out there in the summer and enjoy, even at Michigan, the brief months we have of great weather. But I think there's a lot we have to learn yet. So I'm cautiously optimistic.
Fantastic. And a final question for you, Dr. Chopra. Could you expand on what is Michigan medicine doing in this field to help advance what we know about COVID-19 and how to treat it?
Yeah, it's a great question. So first and foremost, I would say we are trying to learn ourselves. There's a lot of active work going on now in the health system to understand what we're seeing, to share that knowledge across the nurses, the doctors, the respiratory therapists, so that there's a little bit more consistency across how we're treating these cases. The second thing we're doing is we are sharing that knowledge with our partners across the state. So this includes other hospitals and health systems, but also includes the Michigan Hospital Association, our governor's office, where we're sharing some of the models that we've developed on how we think this will spread. So really using that intellectual voltage, the power that we have at Michigan, to inform others. The third thing that we're doing to advance science is really start thinking about testing and treatment strategies. So we've developed, I think, a very good testing strategy. We can test people and get answers back within 2 to 4 hours, sometimes within less than that. And I think the other thing we're working on is clinical studies and clinical trials. We have launched, I think it's now 18 or 19 clinical trials here at Michigan. These are all looking at drugs that you've all heard about in the news. Hydroxychloroquine, we have 2 studies, one looking at patients and to see if it makes a difference, and then one looking at providers who unfortunately may get exposed, but to understand if it protects them in terms of the exposure as well. We have trials on the anti-inflammatory drugs, a lot of the interleukin inhibitors that prevent lung inflammation. Those are ongoing right now, and I will tell you, having given that drug to a few people, those results seem quite promising, and so we are using that here at Michigan. And then we've got trials on the drugs that kill the virus, so the antiviral drugs. The big one is remdesivir, and we are doing a very large trial with remdesivir and the makers of remdesivir to understand if that can help in our ICU population. So we're doing a lot of good science. We're sharing what we learn. We're trying to be consistent across our campus and across the state. And we're doing our best to teach others in terms of things that seem to be working here as well. So if you're a Wolverine and if you're a believer in the Michigan model, this is a good time to be in Ann Arbor. We are doing what we do best, which is spreading the wealth and spreading the knowledge across the health system and across the state.
Thank you so much, Dr. Chopra. Thank you for your hard work on the front line. Thank you for your time. I want to ask you one more question. Do you have any final thoughts, anything you think we've missed or you'd like to share with this audience?
Yeah, I've been very thoughtful about this disease. This has really made me rethink a lot of what we do in medicine. I am just so grateful for all of the brave people I've seen in the front lines with me. And I mean that, in the realest way possible. I'm talking about the nurses, the respiratory therapists, the pharmacists, the doctors, obviously. But I also want to be mindful of the folks that are there every day, the folks that clean the floors, the janitors, the folks that bring food to our patients and to us. Everyone is doing their part. And as a healthcare provider, you join this field for the reasons of giving care to others. I don't think I fully have appreciated how much the team means to us and how it takes all of us together to provide the care. And I would say I feel blessed. I feel very lucky to be able to do what I do, but I feel more grateful for the fact that I'm surrounded by wonderful people around me. And when this is all over, and I promise it will end one day, I think we will come out stronger. We will come out stronger as a medical team. We will come out stronger as a community. And I think we will learn from this so that we can actually prepare for other major pandemics like this one. There will be others. This is not going to be the last one we deal with, but I think this will make us much stronger. So my most important message for everyone is just one of gratefulness, that I feel very privileged to do what I do, and I'm lucky to be where I am.
Thank you so much for your time, Dr. Vineet Chopra. Thank you.
Go Blue.
Go Blue.
Thank you very much.